Hello student doctors, nice to see you again. This lecture is about antibiotics used in the treatment of GI infections. My name is Jeff. Let's get started. First, let's cover two nitroimidazole compounds, metronidazole and tinnitusol. Nitroimidazole compounds refer to a class of antibiotics. They share a similar chemical structure. They're used to treat parasitic infections, amoebiasis, bacterial vaginosis, GI infections, skin infections, meningitis, lower respiratory infections, bacterial infections, diarrhea, and rosacea. Their mechanism of action include free radical formation that damages bacterial DNA. Two of the more frequently used nitroimidazole compounds are metronidazole and tinnitusol, the structures of which are shown here. Metronidazole and tinnitusol. GI bugs treated with metronidazole and tinnitusol include Giardia, Entamoeba histolytica, in which metronidazole is followed by Vancomycin, C. diff, Helicobacter pylori. The normal triple therapy is a proton pump inhibitor, clarithromycin, amoxicillin. If there's a penicillin allergy, one should substitute metronidazole for amoxicillin. In quadruple therapy, there's a proton pump inhibitor, metronidazole, tetracycline, and bismuth subsalicylate. Two high-yield adverse reactions include disulfiram-like reaction, and sometimes these patients can have a metallic taste in their mouth. Now, let's talk about the naturally occurring macrolide antibiotics are a class of antibiotic unto themselves. Four are listed here: clarithromycin, azithromycin, erythromycin, fidaxomicin. The structure of erythromycin is shown here. You can see there's a couple of sugars attached. Usually cladinose and desosamine are at these positions in macrolides. These drugs are typically used to treat infections caused by gram-positive bacteria, to include Streptococcus pneumoniae, and limited gram-negative bacteria, such as Bordetella pertussis or Haemophilus influenza. In addition, some respiratory tract and soft tissue infections can be treated with these drugs. These drugs work through impairing bacterial protein synthesis by binding to the 50S ribosomal subunit. GI bugs treated with these drugs include Helicobacter pylori. Recurrent C. diff can be treated with fidaxomicin, Campylobacter jejuni, azithromycin, Salmonella and Shigella. Azithromycin is used as an alternative drug when other drugs have failed. High-yield adverse reactions include increased GI motility. These drugs can cause upset stomach, but they've also been shown to have some utility in treating diabetic gastroparesis, especially erythromycin. Other adverse reactions include QT prolongation, so-called torsade de pois, twisting of the points, through cytochrome P450 inhibition. These drugs also cause acute cholestatic hepatitis, in other words, bile backs up into the liver, and very early exposure to erythromycin has an increased risk of hypertrophic pyloric stenosis. Let's talk about some of the penicillin class of drugs, to include amoxicillin and amoxicillin is used to treat middle ear infections, strep throat, pneumonia, skin infections, and urinary tract infections. Amoxicillin is taken by mouth or less commonly by injection. Ampicillin is used to treat respiratory tract infections, urinary tract, meningitis, salmonellosis, and endocarditis. It may also be used to prevent group B streptococcal infection in newborns. This drug is taken by mouth by injection into a muscle or intravenous. These drugs impair bacterial cell wall synthesis by binding to penicillin-binding proteins. Resistant bacteria break down these drugs through the action of beta-lactamases. Thus, one is stimulated to use beta-lactamase inhibitors concurrently. For example, amoxicillin plus clavunate, which is called augmentin, or ampicillin plus sulfbactam. GI bugs treated with these drugs include Helicobacter pylori as part of normal triple therapy. If your patient is allergic to penicillin, substitute metronidazole for amoxicillin, and lots of other bugs. High-yield adverse reactions include hypersensitivity reactions. Let's talk about the tetracycline group of medications. So in their very early days of use, they were very broad spectrum, possessing bacteriostatic activity against almost all medically relevant aerobic and anaerobic bacteria, both gram-positive and gram-negative. There were a few exceptions in those early days, to include Pseudomonas aeruginosa, members belonging to the Proteus genus. These bacteria display intrinsic resistance, even in the early days. Through non-judicious use through time, many bacteria acquired resistance to tetracyclines, and that has greatly eroded the formerly vast versatility of this group of antibiotics. The mechanism of action of tetracyclines: they reversibly bind to 30S ribosomal subunit, inhibiting translation. Shown here is the structure of tetracycline. Bacteria acquire resistance to tetracyclines through the rise in the expression of bacterial transport efflux pumps. So they merely just pump the drug back out. GI bugs still treated with tetracyclines include Helicobacter pylori, especially in quadruple therapy, adding tetracycline to proton pump inhibitors, metronidazole, and bismuth subsalicylate. Some high-yield adverse reactions include tooth discoloration in young children. These drugs also have adverse effects on fetal bone and teeth. There's GI side effects as well as photosensitivity. Overall, tetracyclines are contraindicated in children and pregnant women. Moving on to a fluoroquinolone group of antibiotics, specifically ciprofloxacin. This drug is used to treat a large number of bacterial infections. This drug can be used in combination to other antibiotics. It can be taken by mouth, as eye drops, as ear drops, or intravenously. Shown here is the structure of ciprofloxacin. Cipro inhibits both DNA gyrase and topoisomerase 4, so its mechanism of action is inhibition of DNA synthesis. Resistance to Cipro arises through increased expression of bacterial transport pumps and mutation or alteration of the genes that encode DNA gyrase and topoisomerase 4. GI bugs that can be treated with Cipro include gram-negative causes of gastroenteritis, Shigella, Salmonella, E. coli, and Campylobacter. And there are any number of high-yield adverse reactions to include tendon damage, twisting of the points, GI upset. These drugs are relatively contraindicated in children and pregnant women. These drugs can damage growing cartilage, and there's an increased risk of aortic aneurysm or aortic dissection in patients that are administered ciprofloxacin. Let's talk about vancomycin in the context of GI bugs. This drug is recommended intravenously as a treatment for complicated skin infections, bloodstream infections, endocarditis, bone and joint, meningitis, and MRSA. Blood levels are likely to be measured to determine the correct dose. It's recommended by mouth as a treatment for C. diff, colitis. However, when it's taken by mouth, it's very poorly absorbed. This drug's mechanism of action is to prevent cell wall formation by binding to D-ala oligopeptides. One of the main uses in the GI system for vancomycin is to treat C. diff, and when you're doing that, you use oral vancomycin. You use IV vancomycin for most other infections. High-yield adverse reactions include so-called red man syndrome. In order to avoid that, you can pre-treat with antihistamines. Slower infusion rates also help. It turns out vancomycin causes the degranulation of mast cells. Other high-yield adverse reactions for vancomycin include nephrotoxicity, ototoxicity, thrombophlebitis at the injection site, and so-called DRESS syndrome, which stands for drug reaction eosinophilia and systemic symptoms. Student doctors, I've provided you with some practice questions at the end of the PowerPoint or PDF. Please enjoy. It's patently obvious to me that fishing, music, farming, being a student doctor, and lecturing have a lot in common. Go ahead.